And it's been beeping for like 3 hours.
If the capsule is properly placed, and I'm going to tell you guys, make sure that there's 30 seconds of no movement before you push that plunger, okay? That right there is the #1 determinant of a good attachment. If they do that right, the capsule will be very unlikely to come off prematurely.
So those of you that are in the room with the doctor when he's doing the procedure, if you see him move at all while you're doing that 30-second count, or the patient moves or coughs, if there is any movement at all, just restart your account. Because that tissue is being sucked in that tiny little chamber, and if he moves, patient moves, they cough, it gets pulled back out again, so it may not get a good.
What about when they have the hiccups? Because a
Yeah.
lot of the
Then you got you have to wait.
You want no movement for
wait
30
until
seconds.
And
Yeah.
sometimes it means giving them a little more Versed.
Yeah.
Yeah.
A lot of people will give them a little more medicine right before they do it because they want everybody to be still.
Right.
And it's really also important for us too at higher altitudes because it doesn't go up quite as far.
Yeah.
Most of my physicians and nurses wait more like 45 seconds.
Yeah.
Just so you know.
Yeah. Although of course there you need to be careful because you have even more time that they have to lie still. So just be aware of that. But that is the #1 factor, and it's so easy to solve because if they do move, it simply means you need to just start your count again, which is no big deal, you know.
And I would use you guys to do a training doctor too, okay? Because I've never been in a training with him. I've never done a Bravo procedure with him. He's probably not going to do some of the things we're talking about today.
Well, he's done them a lot.
He has.
Yeah, but
he has.
that doesn't mean that
Exactly.
he's
Well,
doing
he
what
wanted to be in
touches.
here today.
Yeah.
But I
We
think
will
there's-
walk him through it.
I will go back through all of this with him because they've had some problems with some of his patients there. So what I'm telling you is what I'm also going to tell him and reiterate, and we're all going to retrain together.
I harp on him all the time, so what
He'll be used to it. So I'll use you as my go-to. Yeah. Another thing that the physicians that were trained, and the problem was, and originally when Medtronic rolled out Bravo, they trained everybody, and then they didn't have any support in the field. So they would do something like this, and then for 2 or 3 years, people were using the product, and there was no retraining.
The main problem was that we would train a physician, and then that physician would train another physician.
It's
And
like
of
the old
course,
telephone.
they don't know to emphasize the small points that we know are important.
Exactly.
And it wasn't, once the product was rolled out, there wasn't any retraining when you figured out some of the nuances. So one of the pieces that you may see come up is when Stans was showing you how the procedure's done, is the relaxed angle. Did she show you that, where you just kind of want this? You may see, I haven't seen him do it, but he may have it like this. There may be some tweaking with the wires which can cause it to misfire. So I am going to go over that with him. He may not be aware of it. So you may see that, so I'll also use you guys to kind of say, hey, they made some improvements and it works a little better like this. Relaxed angle, okay? And that could have caused some of the misfirings that I heard about it.
And I don't teach relaxed angle, I teach it's got to be straight.
Yeah.
Because what's a relaxed angle?
Well, to me, you just don't want it taut.
Yeah, to you. But no, you do want it taut. You want it straight. Because
But you don't want to be pulling on it at all, because then you could be
you
tweaking
want it nice and straight. A relaxed angle to one person is this, to another person it's that.
Sure.
It's just too non-specific. They need to hold it nice and straight between the mouth and the delivery system. Nothing like
Keep your
this.
head up there. He was, hey doc.
Are you seeing a patient?
Well,
Hey, when you
will
hold
you have
your Bravo,
will you have a few moments with us later for us to go over this with you? Let's just do it later.
okay.
Yeah.
We can do
Well,
it right now.
I just want to see, when you hold it, will you show me how you hold it? Do you normally have it kind of up like this, or do you have it out to the side?
I think once that's in there, just like this.
Okay. So essentially, they now want you to do it straight, like so you would have it straight.
Yeah, and of
Like
course
that, just so this
you're
isn't
gonna have it
twisted up
here.
like that.
Oh, right,
And it
right,
shows
so-
in the video like that, so they just made some improvements
So
to
hold
that
it,
piece
just
of
hold it nice and straight.
Straight.
And hold it against the bite block, not in front of the bite block. And something you may not have learned, and you can't see it here, but this is an old delivery system, which is probably what you learned on. Old delivery system doesn't have any feedback lines on it, okay? So we taught everybody push,
Right,
and
just
then
twist.
turn,
Right.
and this one